In Epidemiology Part 2, we will be describing how the virus has spread throughout the world and how the U.S. has failed to control the spread of COVID-19. The initial outbreak began as a point source in the Hunan live animal and fish market, and the majority of cases were among market workers, depicted in yellow. However, within 10 days, the disease rapidly spread person to person to those who had not been in the market, demonstrating early on that the virus was highly infectious. These maps document the rapid spread throughout China. Each 10-day interval documents spread outward from the city of Wuhan, where the market was located, into the entire Hubei province and progressively into the other eastern provinces. The infection quickly spread throughout the world as a consequence of Chinese citizens traveling to Europe, particularly northern Italy. And tourists infected while visiting Italy then spread the virus to New York City. The Chinese also traveled to Seattle, explaining the first outbreak in the U.S. As shown on this map from the Center for Systems Science and Engineering at Johns Hopkins, as of July 18th, there have been nearly 14 million cases and nearly 600,000 deaths, a death rate of 4.2%. To better illustrate the importance of early intervention, I commissioned the famous artist and family friend Bruno Lucchese to draw an image of Pandora's jar. Zeus, angered by the deceptions of Prometheus, warned that a great plague to you, yourself, and to men shall be. He created Pandora, a beautiful maiden, and fashioned a jar, often mistranslated as a box, containing all the pestilence of the world. He encouraged the curious Pandora to open the jar, releasing a plague on all men. 3,000 years later, we are now experiencing such a plague in the form of COVID-19, and when politicians delay applying the tools of infection control, they are leaving Pandora's jar open, allowing the virus to spread, causing unnecessary suffering and death. These are the epidemic curves for South Korea, China, all the European countries, including Italy and Spain, the Scandinavian countries, Australia, and the US. The vertical axis is a log scale of the number of deaths per day from COVID-19. Each star represents the time at which the government implemented shelter in place. That is, when they closed Pandora's jar. Look at South Korea. They implemented shelter in place and aggressive diagnosis and case finding and isolation after observing 3 deaths per day. Note the nearly flat curve for South Korea, pale blue. Also notice the number of cases has dramatically dropped in China, the orange curve. They have intervened after 3 to 4 deaths per day and after a total of 30 deaths. Italy, the black curve, on the other hand, waited until the daily death rate was 75, and they accumulated a total of 800 deaths before ordering shelter in place. Note the steep curve as a consequence of leaving the jar open. Italy has had among the highest number of deaths of any European country. Finally, note the steep curve for the U.S., red. The U.S. did not implement a uniform policy. Some states sheltered in place, others chose not to intervene. The consequence of this approach, we have by far the largest number of active cases and deaths in the world. To make matters worse, we reopened states who chose to shelter in place in early May. Let's look at the latest epidemiologic curve for the U.S. As you can see, the rise in cases in March and April slowed, but never decreased to low levels. This plateau represents mitigation, but an inability to suppress the epidemic because of the varied responses of the states. This contrasts with the European countries who consistently implemented shelter in place for a sufficient duration, bringing the new cases to low levels before cautiously and slowly opening up. The individual states opened up aggressively despite their failure to reduce the rate of infection, and by Memorial Day, many were behaving as though the epidemic had ended, celebrating in bars and crowding onto beaches without masks. Look at the abrupt rise in cases. The U.S. recently reached an all-time record for daily cases, exceeding 75,000 cases in one day. Here is a United States map for July 18th from the Center for Systems Science and Engineering. As compared to earlier maps, the entire nation is now covered in red, indicating significant numbers of cases in nearly all states. And we have a total of 3.6 million cases and nearly 140,000 deaths. We represent 4% of the world's population, yet we have 26% of the world's cases and 23% of the deaths due to COVID-19. New York City has the largest number of cases at nearly 220,734 cases. But growth in cases has dramatically decreased. Los Angeles is second, with over 150,000 cases and rapidly growing. Chicago is third with nearly 98,000 cases, and nearby is Detroit area. It is in fifth with 38,000 cases. Growth has slowed in both of these cities, while in the Miami area, infection is rapidly spreading and now has double the cases of Detroit, being fourth place with 77,000 cases, and promises to soon move to third place. New Orleans is sixth with nearly 21,000 cases, and finally Seattle, the city in the early stages of the pandemic who had the most cases, but now is one of the lower cities with 12,766 cases. This map, generated by Harvard Global Health Institute, shows the prevalence of disease by location. Red zones represent areas with over 25 cases per 100,000. Orange 10 to 24 per 100,000, yellow 1 to 9 per 100,000, and green less than 1 per 100,000. As you can see, the prevalence is highest in the southeast and southwest. Florida has the highest number of cases per capita in the United States, with 55.1 per 100,000, with Louisiana being a distant second with 44.2, Arizona close behind with 43.1, followed by South Carolina, Texas, and Alabama. Let's look at this map of Florida that details the prevalence by county. Look at the Miami area. The prevalence exceeds 100 per 100,000, and the Fort Lauderdale area has 76 per 100,000. And Jacksonville is weighing in at 59 per 100,000. This is where the Republican convention is supposed to be held. The Orlando area, where Disneyland just opened up, has 48.5 cases per 100,000. The Gainesville area, where I practice, has 28 per 100,000. In late May, the Imperial College warned that the number of cases would explode in Florida and estimated the R0 to be 1.2 as of May 20th. As this graph shows, their predictions were accurate, and soon after Memorial Day, a steep exponential rise in cases began. Florida recently had the largest number of cases ever reported in one day by any state, with 15,300. Our governor refuses to mandate masks or consider shelter in place, and the cases are likely to continue to climb, but more about that in Module 2. To better describe the gravity of the situation in Florida, if Florida were a country, it would be fourth in the world with regards to the incidence of daily infections. To summarize the content of this video, the epidemic began as a point source outbreak in a live animal fish market in Hunan, China. As of July 18th worldwide, there are over 14 million cases and nearly 600,000 deaths. Many countries experienced exponential epidemic curves as a result of delays in implementing infection control practices. They left Pandora's jar open. Testing, case finding, and isolation are critical for controlling spread, and many countries have now managed to control the epidemic. The United States has failed to consistently implement appropriate infection control measures, and our cases are increasing at a steep rate, with the state of Florida leading the way. And the U.S., with 4% of the population, has over 1/4 of the world's active cases and nearly 1/4 of all deaths due to COVID-19. Thank you.